Colon cancer is the second leading cause of cancer, but according to doctors, it's also the most preventable. Today we have Dr. Quinn to discuss a new option that might help with screening rates. Good morning, Dr. Quinn.
Good morning.
How are you doing today?
Doing great.
All right, so this is a very important topic, but just kind of emphasize to our viewers and to us, how important is screening for colon cancer?
Well, I'm going to start out with a story of a phone call that I had yesterday just to drive it home. You mentioned that colon cancer is the second leading cause of cancer death in America, which is very true, but it's also very preventable. But what you left off is preventable if you catch it in the earliest stages, which leads me to the conversation I had on yesterday. We are performing a test called the SHIELD test, which is the first FDA-approved blood-based colon cancer screening test that's ever been produced. And we've done about 25 tests and we had 4 positives. So I called one of the patients yesterday that had a positive test and informed her that her test was positive, and she just started crying. She was like, "Dr. Quinn, why are you telling me this bad news?" I said, "It's good news." And I explained to her that the fact that she had no symptoms, no blood in her stool, no stomach pain, nothing, just needed to go get a colonoscopy because it was time for her screening. But she was adamant she was not going because she didn't want to go through the inconveniences or the barriers, which included being sedated, drinking the PrEP, and having to get somebody to drive her home and taking a day off work. She said, "I'm just not going to have time to do all that." And that's when I introduced the SHIELD test, and we just did it in the office. It took about 10 minutes, and I told her, "Now, will you get the colonoscopy?" And she said, "Yes." And I explained to her that when she goes to get this procedure, they can, if they detect the cancer, which is highly probable, it'll be in the earliest stages and they can remove it before it's had time to spread. And I told her, basically, "I'm calling you to tell you that your life is saved." And she was so happy. She said, "Let's just pray." So she and I, we just prayed on the phone for like a good 5 minutes, and hallelujah. So it was just a great experience for me and the patient.
Yeah, and that's awesome that the SHIELD test you're talking about, is it a newer test or is it something that's been around for a little while? Or just give us a few more details about that, because it definitely sounds like it's certainly helping the patient that you have talked to recently.
Right. Basically, it's, as I said, the first FDA-approved blood-based colorectal cancer screening test in the United States. And it's fairly new. It's using a lot of technology where they look at the blood for fragmented DNA particles specific to colorectal cancer. And it's very accurate, and it's very non-invasive. It just takes about 10 minutes. And for those that just don't want to get a colonoscopy for obvious reasons, it's a great alternative. And like the lady that I talked to on the phone yesterday, it can save your life.